Dengue fever has been confirmed in one of the thousands of delegates visiting the island for FestPac. Public Health Director James Gillen, however, assures the public that the patient is no longer infectious.
Department of Public Health and Social Services Director James Gillen says the delegate arrived on Guam on May 22nd, already presenting with fevers. On May 23rd, the delegate was brought to the Guam Memorial Hospital to be treated for prolonged fever. The patient was discharged the next day, but Gillen says public health wasn't notified immediately.
I think the hospital was not aware, that they're required to report right away as soon as they have any presumption of a disease like that. So we were not aware of this patient until the patient was discharged the next day.
At the time the patient was discharged, officials were treating him for Zika virus. Gillen says, fortunately, public health has the ability to test for Zika and other similar diseases now.
Since it was presumptive for Zika, we ran the Zika PCR first, and then, as usual, our protocols anyway run it for dengue, run it for chikungunya. So the first good news was it's not Zika. Okay, and then the next call I got from the team was, oh, but it's positive for dengue. But having the ability to do that quickly, really was very beneficial.
Both Zika virus and dengue fever are mosquito-borne illnesses and are spread through mosquito bites. While the news may be alarming given the presence of mosquitoes on Guam, Gillen assures the public that the delegate who was positive for dengue fever is no longer infectious.
When we did the determination last night with the team, the patient had been febrile for a few days, even before they arrived. So you start counting those days where they're symptomatic. So counting the days and the number of days that a patient is infectious, we were able to determine that there was no more risk. The patient was not infectious.
When is the infectious period?
The infectious period generally is 5 days from the onset of the symptoms.
Gillen also says that the Division of Environmental Health visited all the FestPac sites to conduct an assessment of the effectiveness of their insecticides, and he says so far they have not found any mosquitoes.
We weren't that particularly worried about whether, even if this patient had been infectious at the time, there was nothing there to bite him. We still recommend that if you're out at dawn or dusk, which is when these albopictus mosquitoes like to feed, that you might want to use insecticide, mosquito repellent. And we do have spray booths at all of the sites.
You can read the release online at pacificnewscenter.com.